Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic. And today, just like yesterday, I have in studio with me Mr. Kit Nascimento, who's no stranger to us. Mr. Nascimento has served this country for several decades. In the media, he's a PR guru and oftentimes has the most insightful questions and comments to make. We are very fortunate to have his wit, his insight, and his knowledge here with us today. So welcome, Mr. Nascimento.
Thank you, Doc, and it's my pleasure, of course, to be with you. And thank you for those flattering remarks.
I like to highlight that you have been serving us for decades. It's a badge of honor that you should wear proudly.
Well, thank you very much, Doc. It's an honor to serve one's country.
Yes, it is.
And it is an honor for me to be sitting across from you, who also serve your country in the most remarkable ways.
Thank you, sir. So, just for our listeners and viewers, remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Mr. Nascimento and I are at least 6 feet away from each other. We have both received our first doses of vaccines, and so it's safe, I believe, for us to take our masks off to continue the rest of this conversation. And if you would have noticed, both Mr. Nascimento and myself, we wore the mask to cover the nose and the mouth. Not just the nose, not just the mouth, but both has to be covered when wearing the mask correctly. So thanks again for joining us, and Mr. Nascimento, welcome again. Please feel free, dig away, ask all the questions you would like to know.
Well, let me begin by asking you this. I've noticed that in the U.S., and of course we are exposed to the U.S. and U.S. television much more than any other phenomenon in the world. I've noticed with the Pfizer and the Moderna and the Johnson & Johnson that the second dose is relatively close to the first one.
Yes.
Maybe 2 or 3 weeks.
Correct.
But here we are being asked to wait almost 3 months, 2 months.
Yeah.
And more.
That's a very important question. And thank you so much for bringing that up. The US has the mRNA developed vaccine. That's a different scientific approach to developing vaccines. That is the Pfizer and Moderna. Both of those, for all the studies, all the scientific data, were examined when taking 2 doses at 3 weeks apart. So there is no other data available for, okay, what happens if you take it 6 weeks apart, 12 weeks apart, etc. So that's the Pfizer and Moderna, and that's why the US is sticking to their 3 weeks. The
Johnson is a little sooner, isn't it?
Yeah, so the Johnson & Johnson vaccine is a single-dose vaccine.
Mm-hmm.
So that's a one-time shot for now. We don't know yet if COVID-19 will become a seasonal thing, if it's an annual thing. We don't know yet. It's too early to tell. Remember, the world has only been exposed to this COVID-19 pandemic about 18 months now. So we are still to learn a lot. Now, so that's what's happening in the US. The Johnson & Johnson is a single dose, one-time shot. The Moderna and Pfizer are 2 doses each, given at 3-week interval. Now, the ones that we have here, the AstraZeneca, developed at Oxford University.
And that's the one that's been mainly used in the UK now.
Correct, and across Europe.
Mm-hmm.
Now, that one, they have entered in what we call a phase 4 trial, which is continuous monitoring after administration to a large population. And as the data becomes available, what they have recognized is that if you give it at 3 weeks, 4 weeks after the first dose, you get an immune reaction. But if you give it further away, like 3 months, you get a stronger immune reaction. So you get a bigger boost. And so you may then infer that you can have a longer lasting immunity.
And it makes sense to wait.
And it makes sense to wait. So it's purely driven by scientific data, not anything else, not economic consideration, not availability, not supply chain. It's a purely scientific decision.
Of course, that means that you have to take far greater care on the storage.
Correct.
Because you're holding the same vaccine for a second dose.
Correct, yeah.
For instance, we just got, I believe, 100,000, so we will vaccine maybe 50.
Right,
50,000. Hold that dose.
Right. So the good thing about the AstraZeneca vaccine, again, is the storage condition that's required. Normal refrigerator temperature. That is what's required for AstraZeneca, as opposed to the Pfizer, which requires extreme cold, negative 70 degrees Celsius. That's extreme cold. It takes a lot of infrastructure, and one has to have an established cold chain from production site to administration. And for countries like ours with widely dispersed population, that can be a significant challenge. How do you get the minus 70 degree vaccine to, you know, Mabaruma or Lethem or all those other places?
It's an enormous challenge. I mean, it's tons of money involved.
Yes.
And technology too.
Yeah.
Better, hopefully, to stay with the ones we have.
With the ones we have, which, you know, you can store them in a normal refrigerator. So that's the difference really in the vaccines.
Now, I've had people say to me too, kid, what if you have a heart problem or some other threatening disease?
Yeah.
Are you going to endanger yourself by going and getting vaccinated?
Again, excellent question. As you know, I'm a cardiologist, and that's the question I get all the time from my patients. So I see the heart failure patients, the heart attack patients, the patients with heart rhythm problems, those who were born with defects in the heart, those who would have had bypass surgery. All of these patients, they are the candidates who really should take the vaccines because they have the highest risk of dying from COVID-19 if they get severe infection. It's not just cardiac, but all other comorbid conditions.
For instance, if you're a diabetic.
If you're diabetic, if you're hypertensive, if you're a kidney patient, if you have sickle cell, all those, if you have HIV, all of those patients, they should be the ones who are getting the COVID-19
In fact, they
vaccine.
are at greater risk, aren't they?
They are at greater risk than persons who do not have those diseases. So they should consider strongly to get the vaccine. So for all my patients with heart conditions, please remember you are usually the ideal candidates to get vaccines because heart disease can cause severe problems if you do get COVID-19 infection, and a lot of the higher mortality rates are in persons who have COVID as well as underlying heart disease, kidney disease, diabetes, etc. And obesity is also a big comorbid determinant of mortality.
Break down obesity.
Obesity is people with BMIs greater than 35. BMI is your weight as opposed to your height. There's a calculation that is used there, and it's easy to find.
In simple terms, you're much too fat.
Well, that might be a little harsh, but you know, for various reasons, people have challenges in controlling their weight. So persons who are overweight or obese have a higher mortality risk than those who are within the normal BMI or normal weight range.
Spend a few minutes comparing our vaccines that we're using to the ones that are popular in the U.S.
Yeah, so let's look at it
because people ask those questions.
Yeah. So here is the metric that we use. All vaccines, I would have said this yesterday, But all vaccines, whether it's the AstraZeneca that we have, the Chinese vaccine that we have, the Russian vaccine which is yet to come, the Moderna, Johnson & Johnson, Pfizer, all vaccines are 100% effective in preventing severe illness. The best vaccine to take is the one that you have. Don't wait for the one that you don't have.
So take it when it's available.
Take it when it's available. So that is the first most important point I want to make when comparing vaccines. The second one is for a country like ours, where resources are not as great as others. We were not in the competitive pool to buy large quantities of Pfizer and Moderna. Those vaccines were pretty much bought up pre-production by richer countries. Some countries would have bought several times their actual population size. And it doesn't really leave a lot left over for places in the third world that cannot compete with the price markets. So that's the second one. Then the third issue that we have to consider is the storage requirements. The storage requirements are tremendous for the Pfizer vaccine.
We were
the cold
talking
storage.
about it the last time we spoke. Yes.
Then we look at the side effects. The side effects are similar across the entire spectrum of vaccine. Any vaccine you get, any injection you get, you're going to have some discomfort at the injection site. All the vaccines can promote an immune or an inflammatory response that leads to fever and chills, some headaches, some nausea, some vomiting. Some people feel a little fatigued for a couple of days. There are yet no recognized major side effects of the vaccines. People are not dropping dead from getting the vaccines. People are not getting strokes because of the vaccine. People are not growing extra limbs because of the vaccine. People are not going blind because of the vaccine. So, you know, all of the fear, all of the suspicion, we cannot discount people's worries and anxiety. We can only look at the evidence and say what is and what isn't. And so far, the side effects that we have encountered are mild and they are manageable usually with Tylenol, Panadol, paracetamol. Those are the same thing. And
quite frankly, I cannot imagine why anyone would not take a vaccine as soon as you can get it.
There are a lot of undercurrents, a lot of conspiracy theories being peddled, and there are popular ones that, you know, these are the sleeper agents to introduce population control to make sure that, you know, the third world persons do not reproduce, you don't have children, etc. There's absolutely no evidence to support those kind of assumptions.
If you're under 18, you're not allowed to take it. Why?
Yeah. So the early studies have been based on who are the most vulnerable in the population for death and severe COVID-19. And we have seen that children were not the severely affected ones. So the vaccine initially was not tested. And so therefore, it is not recommended yet for use under the age of 16. But there is an ongoing study that is looking at children and vaccination for COVID-19. And within the next couple of weeks to months, we will have some kind of result to say whether or not it's a feasible thing to vaccinate children at that age. Because it's an important consideration. School is, you know, always a factor. We've cultivated our children on a diet of rigorous schooling, and so when they're home all the time now, there's a lot of other problems that we have to, you know, consider, from psychological to physical. There's been an increase in childhood abuse at home. There's been an increase in psychological disorders for children confined to homes, and so, you know, we need to examine all those things, not just the direct effects of COVID-19.
I have one more quick question for you.
Yes.
There's an awful lot of research and publicity being given to to the use of a prophylaxis called ivermectin. What's your opinion on that?
Yeah. So my opinion, my personal opinion is mine. I have had no real adverse reactions in persons who would have taken it. I myself have taken it.
And it's very easily available in Guyana because we use it for filaria.
Yes, it is easily available. In fact, right now we are on a filaria prophylaxis campaign, and it is one of the medications included in filaria prophylaxis.
Yes, over a month ago I actually took that.
Yeah, so I have no objection to the use of ivermectin as a therapeutic option or a prophylactic option for COVID-19. And there is a growing body of evidence and a growing number of professionals who are leaning in that direction, if not completely convinced, that there is at least no harm. And that is the first rule of medicine, first to do no harm. And then you evaluate success. So
it's a useful second option.
It is a useful second option, and in fact, a lot of places have, had the same approach, the no objection approach. People are hesitant to recommend it fully, but there are several places that have a no objection approach. So, well, thank you so much, Mr. Nascimento, for all of your questions and comments and for sharing your time with us. And I'm sure the viewers and listeners would have benefited tremendously by this conversation that we would have had today. So thanks once again for joining me.
My pleasure.
Yeah, and to those of you who are listening or watching, thank you for joining us. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you.